A warm welcome to each and every one of you present over here today for the 98th birth anniversary of Professor Dr. N.S. Sundaram and honor the 11th Professor N.S. Sundaram and Mrs. Kamala Sundaram Public Endowment Lecture Award today. I request everyone to kindly be seated. So now let us begin with the proceedings. I request our guest today, Shri Sushil Kumar Jivarajka, Professor Dr. Ferenc Kuhn, Mr. Farhan Khan, Pushpasha ma'am, and Dr. Natarajan to please come on the stage. We invite you all to stand for the Saraswati Vandana. Kindly start the prayer, please.
शुभं करोति कल्याणम् आरोग्यं धनसम्पदा शत्रुबुद्धिविनाशाय दीपज्योति नमोऽस्तुते दिव्यादिव्यारे दीपत्कार कानी कुण्डलमोतिहार दिव्याला पाहून नमस्कार तिळाचे तेल कापसाची वात दिवा तेवे देवा पाशी उजेड पडे विष्णू पाशी माझा नमस्कार सर्व देव देवतां पाशी ये ग लक्ष्मी बैस ग बाजे माझं घर तुला साजे घरातली इडापिडा बाहेर जाऊ दे बाहेरची लक्ष्मी घरात येऊ दे घरच्या सर्वांना उदंड आयुष्य सुख समाधान शांती लाभू दे.
Thank you everyone. Kindly be seated. Now I would invite Professor Dr. S. Natarajan along with our esteemed chief guest and guest of honor to lead the lighting of the lamp. Thank you, everyone. We are now ready to hear a special message about Kamala Sundaram Foundation and the Sundaram NBFI Foundation. To share insights on their mission and work, I invite Professor Dr. S. Natarajan once again.
मेरा presentation समीर को बोला समीर okay. Respected chief guest Sushil Jivrajka, my good friend, guests of honor Pushpa Shah, Farhan Khan, and hero of the day Ferenc Kuhn. And thanks my friend coming all the way from Florida, and also welcome Mrs. Mary, my good friend. She looks after me when I go to Florida. So I'm glad. Thanks for all of you who are here. Anyhow, we are having a recording because I know it's a working day and a busy traffic time, and also it's inside in the middle of Sion. So we will be having it in the YouTube shortly. So something about Kamala is my mother's name and Sundaram is my father's name, and because of them I came to this world in 1957, and now we had this Kamala Sundaram Foundation. Earlier it was called as ISOT Foundation for Twinkling Little Eyes, the name given by Dr. Abdul Kalam, the former President of India, who was also a very good friend of mine, and an NGO established in 2005 for the eradication of blinding diseases and for providing access to quality eye care. And you can see Dr. Kalam with the staff that time, and he has come several times, and the painting you see is there in the Sion, in the Matunga railway station, which is the only railway station in the world totally manned by women, and it's a women empowerment area we live in. And that painting is done by a girl called Alisha, who's I keep giving motivation talks to the Leo Club, the Rotaract Club. They are from Leo Club of Khalsa College. And the foundation runs outreach programs in rural and urban slums, and also in tribal areas that strive to provide quality eye care for the underprivileged in Maharashtra. It has numerous projects focused on creating awareness. This is one, and this is the 11th oration we are doing, and we have international guests from all over the world doing it from all the continents. And we are doing screening, providing comprehensive eye care service to prevent avoidable blindness. And the organization takes special interest in promoting eye donation, and the foundation has conducted 5,040 camps till date from the year 2005 till 23. And before that we were doing without any name, but I started Aditya Jyot in 1990, and we have before that in Bombay Hospital. So I have done with the Mahalakshmi Temple, Siddhivinayak Temple, and all the Rotaract and Rotary and Lions clubs. So we have myself as managing trustee, Dr. Uday Salunke from V School director as a trustee, Mr. Vaidyanathan, Sulabha Karnanadi, and also Dr. Krishnan Iyengar. So this was that time governor. I went and took our staff, showed him our work, and I told him, and that's what I do, to take all my staff to meet the dignitaries of India, right from president to governors to CM. And we had at that time 25, and now post-COVID we are 10, and we have done several camps, and recently we have started the Blind Free India Diabetic Retinopathy project in Mumbai slums. We are having an MOU with the Bombay Municipal Corporation, and in spite of Sion Hospital, Dr. Chaya Madam is doing a great job, Nair Hospital, KEM, JJ, and many more like Cooper Medical College, but there are people in slum who don't have time to come right some 600, 700 meters from this place. We have our clinic for the last 25 years, and still patients don't come either there or here. So we have the social workers sitting behind who go door to door, and I'm happy we have done something like 330,000 slums houses. So we have a good data from them, and we have also done Rotary Club activities. So our vision and mission is to provide quality eye care to all those in need through a system based on community participation and commitment, to render charitable services through a system built on society participation to ensure quality eye care to all. This will also include educational activities to highlight eye donation and preventive aspects of eye care. And we have done this in the past, CREAM project, Aditya Jyot Diabetic Retinopathy Urban Mumbai study published in international journals, Pearl study, which is for the children, Stop Blindness, which I started as the president of All India Ophthalmic Society, And these are the projects, and these are our staff working with the children, with the various parts of the slum. So 10 million lives or more than that we have touched. We have done a awareness drive in 350,000 slum households. 85,000 slum dwellers were screened for diabetes. We as eye doctor or eye care organization interested in diagnosing diabetes because recent publication in Nature by Madras Diabetic Research Group headed by Dr. Mohan Vishwanathan said we have 10.1 million diabetics and 15.1 million pre-diabetics, and that means 58% of them are not knowing they have diabetes. We also did project with World Diabetes Federation, and we were acclaimed as the Diabetic Retina project as one of the top 5 projects of diabetes care in the world. And our work has highlighted in the International Corner of American Society for Retina Specialists, and this is our accomplishment. We did a camp, and we did that time Sushil Jivrajika inaugurated it on January 19th, 2019 in Dharavi, just before the COVID, and we came in the Guinness record of screening maximum number of diabetic retinopathy in 8 hours in Dharavi slum. That time thanks to Ratan Tata and the Tata Trust who supported it. And the same later we worked on that from 2017, and we have published that in the JAMA Ophthalmology, which is one of the reputed journals, smartphone-based artificial intelligence-enabled diabetic retinopathy screening, which I'll tell shortly. We are ahead of Google and Microsoft, and we have these are the various camps, including truck drivers. We do, and we also have a genetic lab, thanks to our friend earlier, Dr. late Vasudev Ginde gave a place, then in Khalsa College, and now the Subramaniam Samaj has given a place in Chembur, and glad to all these donors in Mumbai who gives the place free. But thank God of friends like Shivanandan who was influenced and also told my friends, and like that's how I met Sushil. They are all great philanthropists and they support me in every activity, and thanks to all those who have submitted. And we are also doing research. We are working on diabetic retinopathy, inherited eye diseases, and age-related macular degeneration. We also want to create a Mumbai Ophthalmology Reading Center. That means do teleophthalmology, telemedicine for a solution for inaccessible areas. And we have got MOUs with the various National Institute of Sense Organ Japan, with the University of Pennsylvania, Stanton, USA. We have completed that collaboration with MIT, Boston, and also Indo-Australian collaborative projects. And these are some of the camps at various places in Mumbai. And then we have got a place in VISIT, which is a Vivekananda Engineering College, where we want to create that Ayatejot Eye Innovation Project, working on AI and the engineering department of the VISIT College. And also we want a complex intervention to implement a diabetic retinopathy care pathway in the public health system, which has been done in Kerala by my friend Shobha Shivaprasad, who is also the co-author of the paper in the diabetic retinopathy. She did this Nayana Amritam study protocol because Kerala also has high prevalence of diabetes. Rather, India is the diabetic capital of India now. And then, so that's why we decided to take that model and then do it. So we have a lot of projects going on in diabetic project. We have a questionnaire, and thanks to our staff who are working on it, which has these various details, including the health, lifestyle, BMI, and then various things we are collecting. The study reports the prevalence of diabetic retinopathy, sight-threatening diabetic retinopathy, and diabetic macular edema, which we have to treat so that people will, and this is the ones in PMC. This is a mobile phone, which is an iPhone connected to an infrared device. We can screen diabetic retinopathy. We have taught a lot of people who are school dropouts, who are not illiterate, but a school dropout with no degree. And I have talked to the Skill Development Corporation of India, where we want them to give a training, use the mobile phone, and now the Remedio has come out with a media software of diagnosing with one photo diabetic retinopathy, optic disc, the glaucoma, and age-related macular degeneration. This is the Kerala program, and they have done this, and I am not going into the detail. They have done in 150 PHCs, and then a similar thing we want, and we have done that pilot intervention in BMC dispensaries, 15 in the last 4 years, and this is a proposed program for 199 Apla Davakana, which was inaugurated by our Prime Minister recently. And so this is again we made a public interest movie which is there in the YouTube, initiated by Vijay Amritaraj and Andrea Gassi. And we have done several camps all over India, which we do in November, because November 14 is the birthday of Banting, and just celebrated as the World Diabetes Day. We have carried the Forest camera, where I don't have any financial interest, the camera replica, which is about 4.5 lakhs, and you can see my late grandmother and late father in that inauguration of that, which was done on 1st March 2014, which is the first of its kind in the world. And we also formed a not-for-profit organization under Section 8. We call it Sundaram Natarajan Blind Free India Foundation, to make India blind free and to eliminate diabetic-related eye ailment. And I know this cannot be done in my lifetime, and that's why I follow my Guru, Swami Vivekananda. He says, they alone live who live for others, and rest are equivalent to debt. And we have, thanks to Akshay Kumar Sheth, who is a builder from Chennai, and Mr. Padimna Dalmia is an investment person who from Calcutta. We three have formed this Blind Free India Foundation, and we want to collect only 1,000 crores, and our objective is to work on the eye care all over India, from Kashmir to Kanyakumari, Arunachal Pradesh to Kutch. And then we have got a lot of ideas. It's about 2.5 years old. We have made a small progression. We have made several small programs all over India, rural India. We have done this in the Chennai, and then we are trying to rope in all the eye hospitals of India who are working on as an NGO. We have celebrated National Science Day, and then we give prizes for the young students, and we want to encourage. And this was about 300 students who made instantaneously. We gave prizes for the 5th standard, 6th standard, and you can see how innovative the children are on making concept of eye donation. And then this is what we want to do all over India. And then so recently on 19th January was my father's 98th birth anniversary, and we did grand opening of the Sundaram Natarajan Shanmugapriya Free and Charitable Eye Center, supported by Sahachari Foundation, the Light of Hope project run by KamalaSundaramFoundation at Shanmugapriya Healthcare Center, Chembur, which is in a sophisticated building, and which is it's next to the Raj Kapoor studio, which now has apartments, and it's in a it's a 6th floor, and there are 5 floors occupied by the Surya Hospital, which is a pediatric hospital. They have NICU. They also have pediatric ophthalmologists visiting, but we will be doing free and charitable only for the needy. And if anybody wants to come and take the private, because the hospital looks better than Aditya Jyot. Aditya Jyot is a 5-star, and this looks like 7-star, but our aim is only to serve the poor. But if some rich man wants to come and get treatment, I suggest them to pay more than the surrounding private practitioners, because we are not interested in competing with any of the private practice. And Mr. Madhur Bajaj and Brinda Katau from Madhur Bajaj has supported our foundation a lot. He's going to support in the future too. And Brinda Katau is a person from Sahachari Foundation who has given few crores along with the ACG Foundation, which is the Associated Capsule Group from we are the largest capsule manufacturer of the world. So the diabetes, as I mentioned, it's the idea of which says 573 million will have diabetes, and that's why we are working daily. And in spite of that, we want to do this as a stop blindness program, and I call it Jyot Se Jyot Jalao. So this is one of the movement which we started in 2014. This boy is a 9th standard pass. He's carrying the Forest hardware in the box and the optics on the motorbike, which we have trained people like that. Several people have trained and left, but that's our idea. Hope they go and join some NGO and do this all over India. So you can, if you take a fundus camera made by Zeiss or Topcon, the optics will go because of the bumpy road, and this we can carry it, and you can see that's our clinic in the labor camp in Matunga. And I go often. Nobody knows me there, but I love to serve them because, as Swami Vivekananda said, we see the God in every human. And you can see this guy takes a better photograph than me or my Retina fellows, because he is doing that only job, and we want to create job opportunities. And this is a mobile camera which again anybody can use. You can see a beautiful photograph taken by anybody, and India has 1 billion smartphones, and you can see that AI has been by tick mark, which says this media software which says 99% is confident. That means the photograph is good. The blue one which indicates the color difference, and that picks up the diabetic retinopathy. For people who don't understand AI, the number of images are fed into the computer. Here it's the iPhone, and then that computer, the image is compared with the existing, what is the different types of diabetic retinopathy, and it reports who can be referred to an eye doctor and who need not go. So we don't need doctors, we don't need technicians, we need only working hands, anybody. And we have, anybody know, I don't know if anybody can guess, but we have 6,47,745 villages, and that's my dream through Sundaram Natarajan Blind Free to reach all over India. And I know only our Prime Minister has access. In one go he can talk to all the villages, which I can't do, but I want to reach, but I know one man cannot do. If one eye doctor, one organization like ours can do, why not all the NGOs of India work on it? And that's why we see a galaxy of philanthropists who is here, and we have Farhan, who's he will tell what he's come for. And we also work with the endocrinologist, and that's one of the photographs of the BMC camps we do. And this is the best. So Dr. Jovanovic is my second mentor, who's also Dr. Ferenc Kuhn worked with him, and he has trained, and he has instilled a lot of information on managing complicated retinal diseases and retinal surgery. And I think one meticulous thing which whatever Ferenc Kuhn came and told in my ears, you did a great job. That's the best thing, because we every day, I know the Bollywood, and we have actor here, we need patting as individuals for whatever we do, but we need patting people like Ferenc to tell where we went wrong or where we did well. The reason is Dr. Jovanovic has come to my OT, and I was the youngest in Shankar Nethala at that time. He said, you have a golden finger, and thanks to his blessing, I visited Antwerp often. That was my second home. He retired in 96, along with the man who did the first vitrectomy, Dr. Robert McAmmer. I was glad. I think Ferenc Kuhn and me are on the few of the 100 surgeons invited in the whale vitrectomy meeting, where both retired, and still he's alive, and I am talked to him. And in his name we made Dr. Raja Jovanovic International Institute for Fellowship and Training, which we announced on 19 January, and I have 3 fellows waiting, one from Kosovo, which is one of the newest country, old part of Macedonia and Greek, and then the other, and we have Sushil, who's a Consul General of Greece, and we have a fellow from, she's coming in May, but she wants to do a fellowship in ophthalmic trauma from Mexico. She's originally from Republic of Dominic, South America. And then also the other guy, poor fellow, came to Halle in Germany, where Dr. Arne is the president of our International Society of Ocular Trauma, and Ferenc Kuhn is the chairman of International Society of Ocular Trauma, and we, myself, are the faculty there. Every year we train the local European vitreoretinal surgeons who wants to learn managing ophthalmic trauma. One of the best wet labs I have seen. We have the pig's eye for the pig's face for the oculoplasty training. We have the corneal suturing technique, which is what Dr. Ferenc Kuhn and many from Sion Hospital and Nair Hospital today demonstrate. So those days we didn't have all that. And Dr. Badrinath in 84 gave me the enucleated eyes, which were not used for the eye donation, eye transplantation or corneal. He used to give us for practicing, and he said, unless you practice and know the manual of the microscope, the instruments, you will not be allowed to touch the human eye. But now we have all this technology, and now we are also again a faculty in the American Society of Ophthalmics. So when we have training schools in Europe, America, why not in Mumbai? And that's why we have started it. And thanks to Dr. Robert Redak, who gave us a talk in the morning and afternoon, who's now made a global foundation fighting blindness, and we'll have international doctors coming for training. And that was done by Mr. Subramaniam, who's the president of the Shanmuga Priya Foundation. That's my mentor, and next on my left is Dr. Grazia Patile, who was the last fellow of John Wich, and that other guy, Bald, was the Kerfine faculty. He's an engineer who started the dark. So we four have formed a John Wich Foundation to train vitreoretinal surgeons to do complicated vitreoretinal surgery. And you see Dr. Ferenc Kuhn, Dr. Wolfgang Schrader. We three went to see the tigers and tigress, and happy we saw all of them. And we see Dr. Arne Vicentis, who's the chairman in Halle, who has the trauma reference center for the entire Europe and Germany. Halle, even though it's located in the old East Germany, close 3 hours from 2 hours from Berlin and 3 hours from Frankfurt, and where the Ferenc Kuhn is the father of ophthalmic trauma, and we the legend in trauma, and I'm happy we have him here, that's his CV, and the main thing is he's the one who has 360 publications, written 7 books, 2,000 talks, and across 67 countries. I think I've done 80. Thank you. And anyhow, so he has done surgeries in 70 countries, and in recognition, he is also, there's an award in his name in American Society of Ophthalmic Trauma. So without his permission, I know I took permission, but he was repeatedly telling, no, you put your name, but we have done, this was inaugurated by Nama Singh. Thank you, Ferenc. Without your permission, I have put your name. And the reason is we want people to come and get trained, and which is in the making. And the other is Dr. In my father's name, because my father started the first genetic clinic in 1984 in Madras Government Eye Hospital, which is the oldest eye hospital. So we have got it in Auditorium Hospital, and now we are going to have the lab in the same Chembur. And that was inaugurated by my best friend Shivanandan, who is my mentor. This was the lab. Now we have shifted to which we are setting it up, and we are also recognized by the DSIR, Department of Science and Industrial Research. And we will work on ARMD, inherited retinal disease. And then this is my mentor, and whatever I am here today is because of him, Dr. Sengamedu Srinivasa Badrinath, Padma Bhushan. And so he told me in 2005 when I started the foundation, and then Dr. Kalam actually came as a president and told me, why not you put a twinkle in the eyes of the children? Because his friend Dr. Reddy started Little Heart Foundation, and that's how he gave the name Twinkling Little Eyes, and I added Ayate Twinkling Little Eyes Foundation for children, and that's how we started that. And this was supported by now Dr. GBK Trust, and we have started the Padma Bhushan, Dr. S.S. Badrinath International Institute of Community and Public Health Ophthalmology, the Blind Free Mumbai project, which is supported by the GBK Charitable Trust. And I am happy they run the Anglo-French pharmaceuticals. And I think like that we have a lot of philanthropists. And I remember Dr. Kalam when he came in 2013 or 14, and that time 2013 I think he said that time 12,000 crore was available from Mumbai itself for the CSR projects, and now we have 45,000 crore available. I know our Prime Minister has told for health, water, environment, like that 7 things for the CSR project. But I urge everybody, if you have good vision, you live long, you live well, you live happily, and not dependent on anybody. And that's why whoever is philanthropy, I know you have to support the kidney, the heart, everything, and many things like water, poverty still. And I'm glad I represent Roti Bank, and Sushil Jivrajika is a trustee with our chairman Shivanandan. We feed 15,000 free people every day. But in addition, we want to make sure every Indian, we have only 1.45 billion, all of them to see well and live well and maybe live 80 to 100 years old. And that's why we have inaugurated, and it was inaugurated by none other than Mr. Bomane Rani. And he's a good friend, And that's why every time I have an actor, because I want the message to go wherever they can. So the idea is not for only money. Support the cause. That means take care of your own eyes. That result is a good deed, because it will be a part of India that a whole everybody will. So I still remember when Dr. Vedanath called me and said, Nati, thank you for starting this, because a lot of people will bless you and you'll get more awards. And today I got the BU award, but now the awards don't have meaning, but I think I want to make sure whatever I say today, I do it, and I want my best friend like Shivanandan and Sushil Jivarajka, they are my conscience keepers, to make sure every day I do this. Thank you.
Thank you, sir, for that insightful overview of the work done by Kamala Sundaram Foundation and the Sundaram NBFI Foundation. We now move ahead in our program as we prepare to introduce this year's Endowment Award recipient. To present the recipient, read the award scroll and confer the medal, I hand over the stage again to Dr. S. Natarajan.
And I also want to, before telling, thank Dr. Mansi. She is the retina surgeon with me, and I have told her you should do more than me. So thanks today for the live surgery, which she was shy to come in the camera. She did the belt buckle. Everybody congratulated me, but closing the eye, I forgot to thank her. Thank you, Dr. Mansi. And thanks to Dr. Smith. Where is Smith? He went down. Okay. Then get up, man. Because they are now my two left and right hand for managing Aditya Jyoti Hospital when I am working for the poor people. Because Dr. Agarwal's group of hospitals has given me the team and the people to do the paid patient work, but I want to simultaneously do the free work. Where is the? So I'm happy to read the scroll. The Kamala Sundaram Foundation presents the scroll of honor on 18th March 2025 on the occasion of 11th Prof. N.S. Sundaram and Kamala Sundaram Oration lecture to Dr. Ferenc Kuhn, MD, PhD. Graduated summa cum laude from the University of Pest in 1977 and became board certified in ophthalmology in 1981. And he trained at several institutions through Europe and the US. And Dr. Kuhn had been associate professor and deputy chairman of the Department of Ophthalmology at the University of Pest until 1989, when he moved to Birmingham, United States. He was appointed associate clinical professor of ophthalmology at the University of Alabama at Birmingham in 1996 and professor of ophthalmology at the University of Pest in 2003. He has academic appointments in Poland and Serbia as well. And he was elected to be Executive Vice President of the International Society of Ocular Trauma in 2000 and has been its president since January 2012. And he was elected President of the American Society of Ocular Trauma in 2002. His degree is PhD degree in 1999. And he has visited Mumbai in 1990. It's not there in the scroll. In 1997 as the part of the International Society of Ocular Trauma Board with Dr. Kara Trester, the president that time, in February 1997, which was held in Nehru Center. And that time again, thanks to Professor of Ophthalmology from Sion Medical College, Dr. Shanta Motwani was helping me, and Dr. Lahani was a faculty in JJ Hospital, Quresh Muscati, and many others. And we had 100 trauma experts from world over came, and it was an excellent meeting. And also Bob Morris, who was the president, the vice president at that time, came, who also was preceding president of International Society of Ocular Trauma. In addition to specializing in management of vitreoretinal diseases, Dr. Kuhn's main interest has been the epidemiology and treatment of ocular trauma. He played a key role in the development of the United States eye injury registry that has served as a model for similar surveillance system in 25 countries. And Bombay Ophthalmologist Association was one of the first to adopt through me that time. I don't remember, I think Dr. Kanti Modi was the president, and we did it for long, but that time it was manual with two forms for initial report and a follow-up report. He has authored 216 scientific articles and book chapters, authored, edited 4 books, and presented more than 1,500 scientific talks, having visited 51 countries as invited speaker and gave named lecture in several countries. Dr. Kuhn organized numerous international meetings on the management of retinal disorders and on the injuries. He was the principal author of a new standardized language in ocular trauma, and today everybody referred to that, and it is nice to see with the Dr. Birmingham eye trauma terminology, the BET, the proposal has received the endorsement of several international societies and journals and has become the international standard in classifying eye injuries. And I think he deserves a big clap for that, because with all that he has come and spent the whole day from morning, early morning 7:30 to evening. And Dr. Kuhn serves as editor as 11 national and international journals, and Dr. Kuhn continually acts as a scientific reviewer for several major journals. I was driving the car 11 hours from Mumbai to Tadoba, and he was working sitting in the back using the computer. And he was the principal investigator of $500,000 grant from the Centers for Disease Control and Prevention to develop an ocular trauma score, which for the first time helps the ophthalmologist predict the likely visual outcome of the injured eye. He has been the recipient of several other grants and numerous awards from societies such as the American Academy of Ophthalmology and the American Society of Retina Specialists. He travels intensively and has performed live surgeries in 17 countries. The American Society for Ophthalmic Trauma established the annual award, Kuhn Award, in his name in 2021, signed by Professor Dr. S. Natarajan, the managing trustee of the foundation. So we'll request all the people on the stage to be here when I give this. Yeah, I'll do that. Come. Sushi, can announce once he, Sushi, okay, maybe. Correct, that's the reason you are here. She refused to come to the stage, but for the award you are here.
I would request Mrs. Kuhn to confer the medal.
No, Mrs. Kuhn to come here. No, you can give the camera to Smith, and you can come here and because they were married yesterday again, and they're only completing 50 years of marriage.
Because you know why you have to be there. He could not have been what he is without you.
Exactly.
Therefore,
So you can tell that. Dr. Ferenc is nothing without Mrs. Mary.
I would request Pushpaji to give the shawl to Dr. Ferenc. Thank you so much, everyone. Now I request Pushpa Shah ji to give her thoughts on how to create awareness on preventing eye trauma for lay public.
Respected Padma Shri, Dr. S. Natarajan, our today's esteemed speaker, Dr. Kuhn, dignitaries on the dais and off the dais, good evening. I'm deeply humbled to stand before you, all stalwarts. It is an absolute privilege to be part of this event, and I'm deeply appreciate the opportunity to connect with such a dignified audience. I'd like to take this opportunity to acknowledge the outstanding achievements of Professor Dr. S. Natarajan, who has made significant contribution in this field globally. Recently, in just 2 weeks, he presented 18 papers across the continents. Sir, your dedication, perseverance, and passion are an inspiration to all of us, and I salute you for your remarkable contribution. As we move forward, let us continue to strive for excellence, push the boundaries, work together to create a bright future where no one remains visually impaired. I would like to share a few of my thoughts how we can create awareness on preventing eye trauma for lay public. We can do it by education material like information brochures and posters highlighting eye safety, common causes, and prevention. We can organize workshops for community outreach to educate people on eye trauma prevention by connecting with local organizations, schools, colleges, etc. We can use social media platforms, partner with social media influencers and content creators to promote eye safety awareness. We can also take help of media, who can do it by press releases, interviews with celebrities or survivors of trauma to share their stories. We can ask government authorities to broadcast eye safety measures on radio, TV, mobiles. Similar to currently, you must have all heard, like, when you call up somebody or receive the call, first thing is about the cyber safety helplines and cyber safety frauds. So in similar way, even government can do this by broadcasting messages about safety for eyes, how to prevent the trauma and all. So these were a few of my thoughts. Thank you once again for this honor and wish everyone a wonderful evening. Thank you.
Thank you, Pushpaji. I now request Sushil ji to honor Pushpaji with a shawl and flowers. Thank you. Now I request Mr. Farhan Khan to give his thoughts about what, if eye injury happens, what would he do, what to do, so that he can give his opinion about the same.
Well, hi, good evening, everyone. Well, I wasn't informed that I will be saying something, but I was told that I need to say something about what will you do if you have an eye injury. So first thing I thought was not to touch your eye. So let's put an end to it. not to touch your eye. But I would like to share my story with Dr. Natarajan. I met Dr. Natarajan 25 years ago when I was a kid. I had an accident. I had a bad accident when I was in school, and I almost lost my eye. And I was operated, and on my right eye. I was operated, and I would like to say, like, Dr. Natarajan did not save my eye, but he actually saved my life. Because I cannot think what I would have been without my eye. So I'm an actor, I'm a model, I am a brand ambassador for L'Oreal, if you have seen that brand, and there are a lot of brands that I endorse. I have been worked in more than 12 countries. I have got international brands, all big brands, good brands. I'm an actor also, and my eyes. Look at my eyes. Look at my eyes. Yes, my eyes are good. Yes, you, please have a look when I come down. The thing is, one more thing. I am also a sports champion, was. And when I was doing sports and I wanted to be a model, an actor, at that time, I used to feel a lot of dryness in my eyes, a lot of dryness throughout. And what I used to think, like, I will maybe after getting operated after 8 years. So I thought in myself, like, maybe after 10, 20 years, 15 years later, I'll lose my eyes. So I went to Dr. Natarajan. At that time, I was not an actor. I was not a model. I was playing sports. I went to him. I told him, sir, I'm feeling a lot of dryness in my eyes, and it is very irritating. And I am using Tears Plus every day. So one Tears Plus I keep in my bag, one in my bike, and I have to put it say every hour. So I told him, I explained him everything. He saw my eye, and he told me, you don't have any problem in your eye. You don't have any problem. And he gave me some books. Read these books and you'll be fine. I was so irritated. I was like, I'm paying you. Give me something. And he was like the dryness is in your brain. It's not there. And I was like, I was feeling like I'm cheated. I'm being cheated. So, and he told me not to use the Tears Plus, the lubrication, not to use it. And I was like, how can he be a doctor? Is he the same doctor who operated me? Anyway, I went home, the same irritation with the same dryness. I was feeling the same dryness, and the dryness was real. Believe me, the dryness was real. I went home. I was suffering from the same dryness. 3 days, 4 days, 5 days. And he gave me some useless books, a bunch of books, 5, 6 books. I'm sorry, sir. So I thought, fine, I've been using Tears Plus, the lubrication, since a long time. Fine, I'll read that book. I'll give it a try. I'll read that book. I read that book. There were some quotations from, good writers, Vivekananda, Buddha, Rhonda Byrne from Secret, I guess. And there are a lot of good words from there. And it was like, you think that the problem is happening with you, and the problem comes. Like, everything is in your brain. If you think you have pain, if you think you have dryness, the dryness will be there. So I thought I will read that book and I'll be fine. And believe me, like, being positive towards everything, like about your, like whatever you're facing, actually that book helped me. Even today, like, that is, what is that written? I can read that. Yes. I am so damn confident with my eyes, I can read anything. Like, believe me, at that time, 20 years back, sir, I used to feel like, no, I can't read that, I can't read that. But today, after 20, 25 years, I can read everything. Like, and sir, at that time, sir told me, force yourself to read. Think positive. Think that you can do it. And actually, like, I don't know how you will take it. I'm sure you're all aware about it because you're students here or something. But that actually changed my life. So thank you, sir. Thank you, sir. And it should be like, there are a lot of doctors, there are a lot of people who treat with medicines and operations. But this guy, he will treat you, in your brain with the words. So thank you for saving me, saving my eye and saving my life. So I will always be thankful to you. And I mean, I seriously cannot express like how, no. So on one thing, I would like to end my thoughts. A disciple asked Vivekananda, what is worst than losing your eyesight? A disciple asked Vivekananda, what is worse than losing your eyesight? And Vivekananda smiled and said, losing your vision. So do not lose your vision. So thank you, Dr. Sir, for getting my vision back. Thank you.
Thank you, Farhan. And that booklet I keep telling, a lot of people don't like that in the beginning. And a lot of people don't like it because I used a formula called faith, fear, and fraud. So I question everybody, if you have faith with God, 100%, then how can you have fear? Because Swami Vivekananda explains, faith is equal to light and worry is equal to dark, or fear is equal to dark. So how can you have light and dark together? Yeah. So if you have faith, you'll be all right. Yeah. So same thing. Thank you for...
My mom just got operated from Sir 2 months back, and she was seeing some spots there. Yeah. And she was very worried. And she came back and she told, sir, I'm seeing something. So he said, why are you seeing that? Don't see that. Okay? Avoid it. She avoided it, now it's gone.
Yeah, I agree. See, that's where in medicine it's called placebo, but I feel, as you correctly said, you have to treat the person as a whole and not the patient. And then second is the whole body and the mind and soul. So I think you have to be happy, and at the same time, certain places you need surgery, and many times you only need faith. And that's why everything cannot be healed with faith, but you have to have the faith. And I think, thank you for bringing it out, and thanks for coming. And then I know we both are supposed to do some Instagram and other things for creating awareness. And anyway, my team is slow, I know that. We'll do something. Thank you very much, Farhan.
Thank you. Now I invite Dr. Ferenc to felicitate Mr. Farhan Khan.
So thank you, Farhan, for and I think you should see his pictures in the Instagram, and it's a mistake that we didn't project, and so many girls are after him.
So this year, we are proud to present the lecture by Professor Dr. Ferenc Kuhn, a distinguished scholar who has made profound contributions to the field of ocular trauma. So I invite Professor Ferenc Kuhn to the stage for the endowment lecture.
Thank you very much. It's really an honor. I never expected anything like this. But I want to share with you a couple of thoughts that came to my mind when I was asked to give this talk. Having been in the field of ophthalmology since 1977, first, of course, as a beginner, then as a surgeon, but more recently, unfortunately, also as a patient. So this is the title that I gave to this talk, because I want to share with you a couple of general thoughts about the relationship between patient and doctor from both sides. So what do doctors do? You see a person who has some kind of a disease, whatever you call it, condition, or just an abnormality. So we try to heal, we try to treat, and the two are not exactly the same. Treatment means you focus on the condition, but as you heard, it's just as important to look at that person as a body. In other words, don't treat an organ, don't treat a disease, don't treat a tissue. And let me stop here for a second and tell you a personal story. About 25 years ago, a new treatment came along, treating a condition which before that was not treatable. It's called macular hole. And the community of ophthalmologists, of course, was very excited that we can treat this. And there were many articles about how to do the surgery, when to do the surgery, etc. And I remember I was sitting in the panel of a big international meeting, and the person leading the panel, standing here, turned to us and said, "So what is the limit or the indication when to do the surgery? How long do you wait?" And I was sitting as the last from this person in the panel. And all of my colleagues, 6, 7 of us, said a visual acuity number. So in other words, you start reading the chart and you get to 30%, 50%, whatever. And when they came to me, I said, it depends on what the patient wants. And everybody looked at me and says, "What do you mean?" I said, because when you come up with a number, the percentage number, first of all, there is no evidence that that's the correct number. But more importantly, we are not numbers. We are not the same. Each of us is an individual. For some people, even a 1% loss of vision means a lot and will not tolerate that. For somebody else, even 90% of loss is preferable to undergoing surgery. So our job as doctors is not to come up with these artificial numbers. Our job is to present the problem in a way, and I will come back to this, for that person to understand and make a decision for him or herself. So when you are a patient and you meet the doctor, how do you tell whether that's a good doctor or it's not a good doctor? Well, you can look at whether whatever treatment the doctor prescribed works or not. But is that a good way to do it or not? So let's look at Dr. A. You go to the doctor, you complain, the doctor makes a diagnosis the first time, gives you a pill, a drop, or something else, and instantly you're cured. Then there is Dr. B, who will try different things, and they more or less work. This is a very common experience. Then you go to Dr. C, who tries many things and nothing works. So which of these three is the best doctor? Again, these are the options. If you look at this in a very superficial way, you would say it's Dr. A, because, hey, the problem has been solved. Easy. Dr. B, well, it was somewhat successful, but not really, and then, of course, Dr. C was completely unsuccessful. But what if I tell you that Dr. C tried everything she could, to treat a condition which is really not treatable, yet he put all his efforts into trying to improve it. It's very similar in the US. They always try to come up with rankings. So you have two hospitals. One of them is a small rural hospital. The other one is a very famous hospital in a very big city. And they have emergency rooms. They have intensive care units. And then you look at the death rate of these two places. And it turns out that the death rate of people in the very famous institution is much higher than the death rate in the rural hospital. So you would say, of course, that big, well-known place works better. But the problem is the patient population, the diseases, the conditions, the severity of the conditions is much worse in the famous hospital. So you cannot directly compare this. And for the same reason, even I have difficulty judging my own colleagues. If I go to an internist, a non-ophthalmologist, and based on what he does to me, I try to say whether he is good or not, I really won't be able to answer the question. Even among my own colleagues who are not in the very same subspecialty that I work in, I will probably not be able to come to a truly scientific answer to the question of who is a better doctor. So this is not how most people will judge doctors. The judgment comes from something else, which is how do doctors communicate with patients? And very often, unfortunately, the answer is they don't. Instead of explaining things or explaining things properly, they simply tell the patient, this is what I'm going to do to you. So these are the questions that we all should ask when we talk to a doctor. Does the doctor explain to me in a way that I can understand? Will the doctor ask me questions so that I can answer them and so that he can get a better picture of it? And finally, can I say some things which he didn't ask? It's very important to have trust between doctor and patient. If you don't trust your doctor, you should move away and go somewhere else. Because without trust, the relationship cannot be ideal. And trust goes two ways. The doctor must trust the patient. What does that mean? Well, I do surgery on your eye, and after the surgery, there are certain things you are required to do. If you don't do that, either the treatment will not be as successful, or you can actually cause damage to your own eye. So we have to work together. I have to trust you that you will do what I'm asking you to do. But before I do that, I have to explain why I am asking you to do that. And then, of course, again, the patient, trust, who has to be convinced inside that the doctor wants the very best for me. So, when we were in medical school, we were never taught in 6 years how to communicate with patients. And the reason why I practiced medicine very differently from my colleagues was, again, a personal story. I was very sick when I was in medical school after the 4th year, and it was a disease that they were looking for, which, if it is that disease, I would be dead in half a year. And I knew that. And yet, in the 2 weeks while I was at hospital, again, as a medical student, nobody, and I mean nobody, talked to me. Nobody told me what my condition might be. Nobody talked to me what procedures they will do on me. They were very painful back then, because a lot of diagnostics which are available today were not available back then. They didn't tell me what medications they were giving to me, and when I tried to ask, they did not give me answers. So I said to myself while I was in the hospital, if I make it out of this hospital and become a doctor, that's not what I will do. But because there was nobody to learn from, there was no literature to read how to do this, it took me several years to practice how to talk to patients. And I think I learned it. I can tell you long stories about how you judge whether you know how to talk to patients or not, but I don't have time for that. But I will tell you an example. So what you see on these 2 images, on the left-hand side, you see the back of the eye. This is the tissue with which we see. It's called the retina. That's the normal image that you see. On the right-hand side, you see some yellowish tissue covering the retina. That's a scar tissue, and you can do surgery for that. You can take very fine instruments and remove that scar tissue, and if you do it early enough, vision will go back to normal. So I had a patient in Germany when I was working there who came to me with that condition on the right-hand side. And I explained to him that this is a condition that can be treated. I explained how the treatment goes, what the percentages of success are, what the risks are, etc. And I was working there as a substitute surgeon for a friend of mine. Whenever he went on a vacation, I was replacing him. So I said, would you like me to do the surgery or wait until my colleague comes back? And he said, I want you to do the surgery. I said, okay. So I did the surgery, which went fine, and then I left. And I came back a few months later, and this patient showed up again. Now he had the same condition in the other eye. But I found out during our conversation that the eye that I operated on had a complication. It's a 1% chance for that complication, which did happen. He went to my colleague who operated, fixed the complication that I caused, and the patient was fine. Now he has the other eye with the same problem. So I saw him and I said, okay, unfortunately, you developed the same problem in your other eye. So my colleague will come back 2 weeks and then he will do the surgery. And the patient said, no, I want you to do the surgery. And I said, wait a minute, I caused the complication in your other eye. My colleague is an excellent surgeon. He fixed not only your complication, but he can fix this problem too. He said, no, I want you to do it. So this gave me a lot of thought. Why would somebody want me, who caused the complication, to do the other eye surgery? And the only answer I can give is because I was able, he spoke English, because my German is very poor. So I was able to communicate in a way that he had trust, despite what happened to the other eye. So for us doctors, again, to be able to convey not just what's wrong with the organ, but a lot more is something that should be taught in medical school and should be practiced in everyday life. So when you talk to the patient, and officially this procedure is called counseling, you try to describe a lot of things. But this process is a very complex one. You have to have empathy. In other words, you have to be able to put yourself in that patient's position as much as possible. And I will also tell you, it is not possible to do that 100%. Any of you doctors who think that when I ask you, so if you have this or that condition, what would you do yourself? And you give me an answer, I will say, that's what you say now, that you don't have the condition. When you have the condition, your mindset will completely change. So when I say empathy, it means putting yourself in the other person's situation as much as possible. And then you describe a lot of things about the condition. I will briefly mention that. But also you have to pay attention to your meta-communication, your facial expression. What do you do with your hands? And something else which is very obvious. So you talk to the doctor about your problem, and the doctor does this. Do you understand that the doctor looks at his watch? The answer is yes, you do, because we are, constricted by time. Like, I don't finish in 5 minutes, and then we have to leave. But you have to do it in a way that the patient will not see it. Because if the patient sees it, obviously the conclusion, consciously or subconsciously, will be, okay, so he's not interested in what I'm telling him. He wants to go somewhere else. And then what you tell the patient. So you have to describe the normal, just as I showed you on those two color images, and you have to explain the pathology, the disease. And you have to try to give numbers to the patient, saying, for example, there is a roughly 80% chance of me being able to remove that scar tissue, and there is a 1% chance of that procedure leading to a complication postoperatively, and you describe that. But counseling is not a one-way street. It's not that you sit there and I am telling you things and you try to absorb it. That's not how it works. When I talk to you, my job is not only to convey what's in my brain about that condition. It is also, I have to read your face to see whether you understand what I'm saying or not. And you have to change how you describe the problem based on the person's individual traits, how intelligent, how educated that person is. I remember I was trying to describe things to people who lived in the mountains of Montenegro in Europe, where they live on a mountain in a very wild environment, both in terms of nature and human nature. They will look at you like this, and you really have to tailor what you're telling them accordingly. And you talk very differently to a colleague who knows all the words that you have to explain to somebody who's not in the profession. So based on what that person does will change how you talk to that person. And then we come to a very important question. Who makes the final decision? Traditionally, the doctor does. In other words, I will tell you, this is your condition, this is how you treat that condition, and this is what I'm going to do. This is very typical. This is how I was brought up. The patient came in and the doctor said, okay, I'm going to do surgery on you tomorrow. That's it. So there was a very famous case more than 100 years ago in the US where I don't want to go into the details, but this is what the judge said. The essence of what he said is this. You own, we are talking about the eye, you, the person who came to me with the problem, you own the eyeball. I don't own the eyeball. You own the eyeball. Therefore, my job is not to tell you what will happen to your eyeball. My job as a doctor is to explain things again in a way that you understand so you can make the decision what options you choose of those that I present to you. And this is the philosophy I have been following all my life. I explain and let the patient make the decision. Now, sometimes, and I will give you an example, sometimes I really disagree with that option. Example, you have a surgery or an injury after which there is a purulent infection inside your eye. And we know that if you don't treat that, you lose vision very rapidly, forever, and you have a good chance of eventually losing the eyeball as well. But still, if the patient says, I do not want treatment, the patient has the right to say that. But I don't want that to happen. So if I tell the patient, you have basically two options. To do nothing, you lose your eye, or we go to surgery now, and I will try to save as much as I can. And if the patient says, I don't want surgery, I said, listen, let me explain again. We have hours or days to intervene. If you don't have surgery, you have zero chance of vision and a very good chance of losing the eyeball too. Are you sure that's what you want? And if you do that, nobody in my practice ever selected no surgery. But still, the right to say that is not mine, it's the patient's. Vision is very important. We own that, know that. Almost all the information from the outside world comes to us through our eyes. That's what you lose if you go blind. So, if you have an injury and you decide to wait, and I have seen very intelligent, very educated people not going to the doctor with that problem because of, and here is a list of possible explanations why you don't go to see the doctor. That's a terrible mistake. So as a general public, the most important message is if something happens, don't wait. The more you wait, the less chance of you coming out well from that situation. There is nothing positive. Just like when you are on the track, and this train is coming, don't wait. Move away. Go and see the doctor with the condition. So our job as eye professionals is to restore vision, and the best example of successful surgery is a cataract, the most successful surgery on the human body. And there are many, many other diseases where we have very good methods of treatment. And then injuries, where it's a lot more complex, and unlike the first category before the previous slide, this one requires a more special treatment, and a lot fewer people do trauma, and therefore you better go to a place where a lot of injuries are treated. Cataract is a fairly simple, very fast, very effective procedure with a very low complication rate. And once you have that cataract removed and an intraocular lens that you see on the finger on the right is implanted, almost all patients will have excellent vision after. But this is a very important thing to remember and mention, because one of the things that all those who are in medicine, but especially in the field of injuries, should understand that you cannot just follow what other people did. You have to use your brain, you have to think differently out of the box. So cataract surgery has been around for hundreds of years. It was done very differently. But what's common about it is that that cloudy piece of lens, which is the cataract, was taken out of the way. Again, different methods. But that little organ there, tissue, not only has a function of letting light in, it lets you concentrate on different distances. So if a young person looks at this room, he can see very clearly what is on the laptop computer or in a book and into the distance as well. If you take out the lens, that's gone. You see nothing without glasses. So after cataract surgery, we used to prescribe a very thick lens for the patient, which gave you relatively good vision, but it was very thick, heavy, inconvenient. So this person on the right-hand side, or actually both of them, the young version and the old version, was one of those surgeons who was taking out these cataracts. You take out that lens and surgery is done. And one day he had a medical student in the operating room, and the medical student looked at Sir Harold Ridley, the surgeon, and said, "Why don't you put something inside the eye to make up for that loss?" And that led us to today with the intraocular lens. But it had to be somebody outside the profession, because that person's mind was not on a track where you simply follow what everybody before you did. So what I'm telling my colleagues, young colleagues, is to not follow, but come up with different ideas. So I just want to show you a brief video, and then I'll stop because of the time. So this is how cataract surgery is done today. It used to be a long, difficult operation with possible complications before and after. And, I'm sorry, during and after. So what you see here is, this is the actual lens, which is taken out by an ultrasound and then aspiration, and then this intraocular lens is implanted. In a very experienced surgeon's hand, this surgery now takes 5 minutes. It used to take half an hour, and a lot of potential complications during and after the surgery. So technology has improved tremendously in the last 30 years or so, and that means that a lot of the patients that I saw when I was young who went blind will have excellent vision today. But for that, as I said, you have to go and see your ophthalmologist. If you don't, and I remember patients who were blinded in one eye with one disease and they still did not go to the doctor, and then they had the same disease destroying the other eye and they still wouldn't go to the doctor until somebody grabbed them and said, come on, let's go. So, in conclusion, the horrible way of practicing medicine is the doctor is up here and the patient is down there. That's not a doctor who does that. You have to be partners. You have to work together. You have the same goal, making the condition better, and you have to work together throughout the whole process, which can take many years in certain conditions, or forever, for example, in diabetes, to work together for the same goal. And do we have the sound on? Let me finish with, on the funny side, it's not only true for doctors, but in life in general, if you can't fix the problem, at least have an explanation about it.
Puis avant que je puisse réagir, j'étais embarqué dans un camion de livraison, et voilà comment j'ai atterri ici.
Ah, c'est incroyable, hein. Hein? T'entends ça, chérie?
Oui, c'est fou.
So finally, I want to say thank you for an exceptional person, an exceptional ophthalmologist who is also a great humanitarian, as you heard. And that was just part of what he has accomplished. There is nobody else like him in the world. I can testify to that because I have been to almost 70 countries as an ophthalmologist. And also my wife, who's sitting there, because he put up with me for all these decades when I was not at home. So without her, without him, I would not have been where and what I am today. Thank you very much.
Amazing. Thank you so much, Professor Dr. Ferenc. Throughout the day, we learned ophthalmology from you, and late evening, we are learning how to practice ophthalmology. That's a complete package for us throughout the day. Thank you so much for your all the insights and all these things, which will help us young generation surgeons to lead next few decades in ophthalmology. Thank you so much. Now, if anybody has anything, any questions to ask, then we'll move forward. I would like to request Dr. Natarajan to once again honor Dr. Ferenc with the plaque for his lecture today. So the plaque reads, on the occasion of the 11th Professor Dr. N.S. Sundaram and Mrs. Kamala Sundaram Endowment Award, Dr. Kuhn, summa cum laude, graduate from the University of Pesth, 1977, became board certified ophthalmology in 1981 and earned his PhD in 1999. He has held academic positions in Hungary, United States, Poland, Argentina, Germany, Serbia, including as associate clinical professor at the University of Alabama and professor of ophthalmology at the University of Pesth. A leading expert in ocular trauma and vitreoretinal disease, he played a key role in developing the US eye injury registry and the Birmingham eye trauma terminology, which is everybody know in the ophthalmology is BTT, BET. Now the international standard with 360 publications, 7 books, and over 2,000 talks across 67 countries. Dr. Kuhn has received numerous awards and grants, including from the CDC to develop the ocular trauma score. He serves as editor and reviewer of numerous medical journals and has performed live surgeries in 17 countries. This is from Professor Dr. Natarajan and from the KamalaSundaram Foundation for the Dr. Ferenc too. So now our chief guest, I will request Mr. Sushil Jivrajika sir for his insights on today's trauma oration and his views on how he can help us as a community to prevent eye trauma in general population.
Dr. Ferenc, my close friend Dr. Natarajan, Dr. Shah, and Farhan Khan, other distinguished guests, students, doctors, and Dr. Ferenc's charming wife, Mary. Good evening to all of you. Before I comment on anything else, one thing I'm sure, Dr. Ferenc, that you had very clear vision despite your injury in your early age, because otherwise you would have not remained married for 50 years to Mary. So, congratulations to you on that. We heard Dr. Natarajan giving the background of Kamala Sundaram Foundation and the tremendous work being done. I have been on the board of Aditya Jyot Eye Hospital, and we've been very close friends for over 25 years. And I have seen his tremendous energy to, I mean, you know, he can be working till 2 a.m. at night and then performing a surgery at 7 o'clock in the morning. From where he gets this energy, he's only 1 year younger than me, but you can see that his energy is unbelievable. He travels all over the world, has trained so many doctors, given so many lectures. His passion for research and serving mankind is unbeatable. And therefore, I'm very privileged and proud that I have a friend like Dr. Natarajan. Dr. Ferenc, I heard your speech just now. I'm not competent to talk on the medical side or on ophthalmology, but I did hear a speech of a great humanitarian, You spoke about things which I have rarely heard any doctor speak, especially in an oration speech like this one. You were not talking in medical terms, you were talking in simple terms which any ordinary person will be able to understand. You spoke about body language, you spoke about empathy, about the way you communicate. I have never understood why doctors write down prescriptions, because I'm sure that they cannot understand their own handwriting. I don't understand why they don't talk to the patient, they talk to the resident doctor in the hospital, and they are looking at test reports and behaving as if the patient is only an object. He hardly has any role in the whole thing. They're talking to nurses, shouting at this one, that one, and behaving as if the patient is the least important. He'll spend 30 seconds on talking to the patient in a language which the patient certainly doesn't understand and has no clue of why he's being treated, what is his treatment, and what is going to happen to his body. He has no clue. And you very correctly summarized that the right to ultimately take the treatment or not take the treatment has to be of the patient, but he can take that decision only if he has been explained in simple language, not in medical terms, what is the disease, what is the problem, what will happen if he doesn't undergo the treatment, and then leave the decision on to him. So I think this was a fantastic presentation made. Only somebody with your kind of maturity and your global influence, you've been to 70 countries, written so much. Thank you very much for your oration. Yes, he deserves a very loud applause. As I said, I'm not a doctor, I'm not from the medical field. But one thing I know, that vision has nothing to do with eyesight. I see all around politicians who are blinded by power, businessmen who are blinded by greed, many mining companies who make children work in hazardous conditions to take out mines. I see all of society whose vision is impaired because we mindlessly throw the waste into rivers, have polluted our oceans, and are destroying marine life and leading to an existential crisis. I see technology czars who are not interested in finding a solution to the problems of mankind, but in creating greater value for their own companies. We saw how one medical company in the US, she became a billionaire and then came to know that the whole thing was a fraud. And I don't know how society judges what should be valued. For example, a company making chips for AI gets valued at $3 trillion. But a researcher who is finding a solution for water or for food or for hunger or for eyesight, they will have to beg for money. And forget about 3 trillion, you will not get a valuation of $3 million also. Dr. Natarajan and people like you have to struggle to find money to do the kind of tremendous work that you are doing, It's very unfortunate that what is the most valuable, you can't live without water and you can't live without food, and yet that is the least valued when you go to people with money. So where is capital flowing? I mean, this is a question that we as society should answer, because what are we leaving for the next generations? Who is going to correct the vision of people who have perfect eyesight? This is the question that troubles my mind. I look for answers and I don't have, but I do hope collectively as members of society, that we take on our own responsibilities and see that we also behave in a sensible manner to ensure that the ills that are plaguing our society do not lead to an existential crisis. A lot is happening on great changes can be done with the use of quantum computing and artificial intelligence, and it can speed up many of the health problems which would otherwise take decades to solve. It could be done in 1 or 2 years time. But we are also in the fear that if not used correctly, it can lead to the extinction of mankind itself. I, I read a book by Noah Yuval Harari, is one of the greatest futurists of current times, in his last book, and he was in Mumbai for a lecture. And he says if you give unbridled power to artificial intelligence, one day robots will become so intelligent in the next few years that they will feel that mankind is redundant, and so why do we need them, destroy them. They will become more intelligent. I read another book by Ray Kurzweil where he says singularity is nearer, and he says that machine intelligence will exceed human intelligence by the year 2029, and after that it will grow at such an exponential rate that robots will be able to do everything without human intervention. What happens at that point of time? Are we addressing these ethical issues? Are we blurred in our minds? Is our vision clear? Every day we see mindless wars being fought across, climate change being a real issue, and people saying that it is rubbish and it should be stopped. And some friends of ours in Florida, they I want to take over this country, I want to make this one a state, I can do this, I can do that. I mean, there is so much of chaos, confusion, and despair all over the world. I don't know when, how people from different walks of life will get clarity in their vision and save the planet for a better future for the next generations to come. I hope they can do that. We talked about how we can get funding, and I tell you, it is a real big challenge. We can talk to a lot of industrialists, and I'm involved with 6 NGOs, and I know how difficult it is for getting, even a few $1,000s out of people's pockets. They will spend $1 billion on a marriage, but if you have to get $1,000 out for a good cause, it's extremely difficult. You have to go with a begging bowl. So, how do we bring about awareness? How do we prevent rather than only work on the cure? Diabetes is a major issue. I saw a video of a guy in Kerala with jackfruit powder. You can in 90 days you can reduce or even cure diabetes. Now these are natural. God has given us these cures. Why should, and we have 2 billion jackfruits in this country. We can solve diabetes in the whole country with just jackfruit powder. So why not look at natural solutions, and why not see prevention rather than focus on cure? Unfortunately, I also read an article in a survey that 48% of surgeries have been conducted which are not required, but only were done because corporate hospitals had put budgets and targets, and the doctors would have lost their job if they had not forcibly done the surgeries which were not required at all. So we need to correct these ills in our society, and I do hope that we will find solutions. I'm a great optimist, and I look at the future in a very positive manner, and together we can find solutions for having a very clear image for the future. Thank you very much.
Thank you so much, sir. I would like to request Dr. Ferenc, Kuhn and Dr. Rajan to felicitate Mr. Jivarajika sir. So I will not take much time, but at the end I would like to really uh, pay my thanks to our chief guest, Mr. Sushil sir, our guest from all the way from America, Dr. Ferenc sir, and his wife Mary madam, Pushpa madam, Mr. Farhan, and also I would like to thank Dr. Chaya madam for constant support throughout the day. Our team, all the team from Kamala Sundaram Foundation, also Joseph from the Kamala Sundaram Foundation, your resident doctors and your team who has worked tremendously under your guidance. So we are very, very thankful to all the resident doctors also. Our sponsors, Alkhan, Anthod, Reticare, Bosch and Lomb for their support today. Our audiovisual team, our team back at the hospital for the live surgery, conduction of a smooth live surgery today. And at the end, I would like to say big thank to our guide and our, let's say, motivator, Dr. Natarajan, for all the efforts what you put. Sometimes I really wonder, a person who has achieved name, fame, money, whatever you can say, why he is still 24/7 actively working. But then again, I realize immediately that he wants to give back. It's the only motto that, his passion to give back to the society is just so infectious that everybody gets the energy and work around him all the day and night. So thank you for all the motivation day and day, every day. We are honored to work under you, and will support whatever the vision you have to make India blind free. Thank you so much. Yes, and the best I forgot our photography and videographer team. Otherwise, they will not send us the photos tomorrow. So again, thank you so much, Stephen, for all the, and my Samir IT in charge. And this behind any conference and everything, this three department, the IT department, audiovisual department, and the videography department are the pillars. It takes lot of their efforts to make a program like this as a grand success. So we are very thankful to all of you, and we seek same support on the 4th of May. Yes, it will be there. YouTube, it will be very soon, it will be uploaded.